This is Dr. Supreet Shah at Truspine San Francisco Clinic. Today we're going to be talking about shockwave therapy and how it connects with plantar fasciitis. So shockwave therapy, or also known as extracorporeal shockwave therapy, is sound waves or acoustic waves that go deep into the muscle, tendon, or ligament. It's great for patients that are looking for an alternative to the conventional treatments, such as orthotics, injections. Those can sometimes cause a little bit of pain and put you out for a few days. And so this alternative treatment is actually pretty useful. So shockwave therapy can help with tennis elbow, golfer's elbow, and most tendinitises, as well as knee pain, shoulder pain, and even plantar fasciitis. Plantar fasciitis is pain at the heel, specifically at a bone called the calcaneus, and usually presents as sharp pain, mostly felt in the mornings or after long walks or running. The acoustic waves coming from the shockwave unit penetrate deep into the muscles and tendons and ligaments, creating what we call some local circulation. So increasing that local circulation and reducing the inflammation can really help to alleviate that pain. Plantar fasciitis can affect those that may find themselves sitting quite a bit, or on the opposite side of the spectrum, those that are moving too much, such as athletes. It can affect male or females equally. But the biggest question is why? Why does it occur? It occurs because of what we call a repetitive stress injury to that area, to that muscle. Now, there are many different options to reduce plantar fasciitis, things that could help, orthotics, using a night splint, and also a corticosteroid injection at the spot. A lot of those take quite a bit of time and can sometimes put you out for some time. And so our patients really love the alternative approach of shockwave therapy. And shockwave therapy emits acoustic sound waves into the bottom of the foot, where you may feel the pain, breaking up scar tissue and muscle adhesions. This can be done in as little as or between 7 to 10 visits. Yeah, we definitely get a lot of athletes seeking our treatment here at our San Francisco clinic. And mostly, I would say, in terms of sports, running sports, such as soccer, basketball, or just track, seem to be mostly affected by plantar fasciitis. Shockwave therapy are for those that want a faster recovery, less time away from work or their family, and just to be able to continue doing what they love without taking any breaks while going through the treatment all at once. What I love about shockwave therapy is that there's such short recovery times. It could be between 7 to 10 visits, and it's not painful. So no side effects. In addition, the cost. So the cost also is quite less compared to going the corticosteroid injection route or the shot route or the surgery route. And so that could be a very big plus point as well. We've also seen that weight can potentially contribute in plantar fasciitis as well. And weight in combination with increased amounts of sitting can do that, especially with a poor ergonomic posture, usually affecting those that have jobs where you're required to sit for long periods of time. Shockwave therapy are acoustic waves that are emitted from the unit that go deep into the tendon or ligament to help reduce inflammation and increase local circulation. What we've seen is that with shockwave therapy, there are essentially no side effects, or very little. At the most, we've seen maybe about 10 to 15% of our patients feel slight discomfort, usually soreness, but nothing more than a workout soreness. What I really like is that there's almost little to no side effects and little to no downtime. The patients can still continue engaging in their work and their activities while going through the treatment process. The way that one would know they have plantar fasciitis is if they are feeling pain at the bottom of the foot, specifically the inner heel, and mostly felt in the mornings when taking that first step out of bed, and also after doing activities for long periods of time, such as a long hike or a long run or walk. You may feel it a little bit more. Again, felt as a sharp pain at the bottom of the foot when it's first noticed. So most individuals will have tried a variety of remedies prior to seeking out our help. That's icing at the bottom of the foot, rolling out with the lacrosse ball at the bottom of the foot, trying different orthotics or stretching techniques. Now, if all of this seems to help, but not get you to 100%, that's when you want to seek out professional help, and possibly at our clinic for some shockwave therapy treatment. So there are a variety of other therapies in the conventional route, and that could mean, orthotics. That could mean a night splint, as well as a corticosteroid injection. Those can help to a certain degree and may not get you full relief. What I like about shockwave versus other therapies is that there's almost little to no downtime. And so you can still continue engaging in activities, going to work, while going through our therapy. The other big thing is cost. There's a big difference in cost going the traditional route versus the shockwave route. And that's something that is favorable to patients to try the alternative route using shockwave therapy, especially here at our San Francisco clinic. One more thing, the side effects. There's almost little to no side effects. I would say about 10 to 15% of our patients feel a slight soreness at the area the therapy was delivered, and it's very short-lived. And so that's another big reason why shockwave therapy is probably the choice for most candidates. So our process with shockwave therapy treatment is usually, depending on the condition, 7 to 10 sessions, which can last between 7 to 10 minutes per session. That means that we will be performing the shockwave therapy at the intended area for that amount of time. While going through this process, it's important to also be doing your stretches and exercises. So I would love to say that the shockwave therapy alone cures all, but there is some responsibility on the patient's side as well. So part of our process is also showing you what those exercises and stretches will be, when you come into our San Francisco clinic. Plantar fasciitis can sometimes present with other co-issues. That could mean, a pelvic imbalance. It can mean tightness in the hamstrings or glutes. And these are things that we look at. So looking at the body pretty much as a whole, not just the area of discomfort or pain. And so that's where those exercises and stretches, depending on why you have plantar fasciitis, comes into play. So we'll be discussing and taking a look at not just your foot pain, but also see if there's any other contributing factors, meaning biomechanical imbalances above the foot that may be contributing to your pain.